Hi everyone, so I'm back with the next set of questions. I had previously uploaded a video with the initial 28 questions of the morning batch. Now I'll be discussing the remaining questions. And guys, don't worry about the genuinity of the question because I myself have appeared for the exam and these are my memory based questions and everything which I am telling here is genuine. So don't worry about that. So moving on to the discussion, let's discuss the next question, the 29th one. So an image of Nocardia was shown and they asked about the stain. The stain used is, so this is an image based question and we have to be familiar with this kind of questions. So many image based questions are there. Stain used is Z in stain. The answer is Z in stain. Next question. Okay, it's 30th answer. So the question had mentioned class switching is observed between IgM and IgD. So which property does this show? Which property does this show? So the answer to this is somatic hypermutation. The other options were affinity maturation and RNA splicing. Moving on to the next question. An image with injury to fibula was shown and the nerve which gets involved was asked. Which is the nerve is the question. Which is the nerve involved? So the answer to this is common peroneal nerve. Okay. The next question was a direct question. Hemibalismus is caused by lesion to. Answer to this is subthalamic nuclei. Okay. The next question is an image was shown which showed the muscles of the lower limb. So the muscles of the lower limb, the diagram was showing the muscles of the lower limb, but the muscles were not mentioned. The arrows were there, but they were not named. 1, 2, 3 was given, and the question was, which is the muscle that is involved in an RTA case, and it had also mentioned in the question that the muscle is an abductor of the hip joint. So the muscle involved is an abductor of hip joint. So I found the answer from that word which had told that it is an abductor of the hip joint. So these are some things like which while we learn some of the points, some sentences we'll be remembering and that will help us find the answer to the question. So from the word like the sentence, the muscle involved is an abductor of hip joint, I found the answer as gluteus medius. Because that was the only option. Gluteus medius and minimus are the abductors of hip joint. But minimus was not given, medius was there in the option, so I found the answer like that. Next one is anion gap is seen in. So the options were there like respiratory acidosis, metabolic acidosis, respiratory alkalosis and metabolic alkalosis, all the 4 were given. So the answer to this is metabolic acidosis. Moving on to the next question. Organ with least arteriovenous difference. The answer to this is I think the answer to this is skin. The other options were brain, brain, kidney and heart. The next question, it was the requirements which are needed for cannula insertion in a newborn baby. So few options were given, like an 18 gauge needle, 26 gauge needle, gloves, normal saline, syringe, everything was given. So we had to choose. It is a multiple correct answer question. So the answer to this is 26 gauge needle, not needle, cannula, gloves, normal saline and syringe. So moving on to the next question, 37th one. A patient came with RTA to EMS department. Okay, NCCT normal, breath sounds normal, raised JVP and BP was 80/60. Next step. So this clearly shows a case of cardiac tamponade, and so the next step is needle thoracostomy. Moving on to the next question. An ECG was shown. The ECG was of Morbid's type 2 block. So they were asking which type of heart block it is. Only the image was given. It was not mentioned Morbid's type 2. The image and which type of heart block was the question. It is second degree heart block. The next question. Baby born to a mother who takes diethyl stilbestrol will develop. So different types of cancers were mentioned. The answer is clear cell carcinoma. Next question, the 40th one. An image of influenza virus was shown and it was asking no, it was not the image of influenza virus, it was the images of the options. So the question was having influenza virus similar to influenza virus. Which other virus shows antigenic shift? So the diagram of Ebola virus was there and the answer is Ebola virus. Okay, it was a diagram of the Ebola virus which is the answer. Moving on to the next question. Image with yellowish deposition on enlarged tonsils was shown. So this is seen in. Answer is Tancher's disease. The next question, all of the following are smell perception tests except. So this is a kind of easy to rule out question. So I found the answer as upset. The other options were easy to rule out. It's mostly direct. The next question is, an image of oxygen dissociation curve was shown. And left-sided hyperbolic shift was shown. So since it was a hyperbola, it is myoglobin. If it was just left-sided shift, it would have been fetal hemoglobin. Fetal hemoglobin was also an answer, was also an option. So this is a little tricky one. We have to be careful, but it's direct only. Just be a little careful. Next question is, vesicular rash is seen in. So few options were there: dengue and hand, foot, mouth disease. So the answer here is hand, foot, mouth disease. This is a direct question. And the next one, an image of subdural hematoma, subdural hemorrhage was shown, and it was asked which blood vessel is affected. So the answer is, as we all know, it's again a very direct question. So the answer is bridging veins. Moving on to the next question. A female in the reproductive age group was asked for a non-contrast CT, which of the following should you inquire? So the answer to this is LMP, last LMP, because it's a female and she's in the reproductive age group, so we have to be careful. The next question. First trimester abortion is done with all except. So the options were D&C was an option, then the other one was vacuum aspiration, and another one was mifepristone and misoprostol, plus misoprostol, and the next option was instillation of ethacrinic acid into amniotic fluid. So this is a little confusing question for me. So mifepristone and misoprostol is the most common one, but the other three were a little confusing. Even D&C and vacuum aspiration not that common. But I think the answer to this is instillation of ethacrinic acid into amniotic fluid, but I'm not so sure about the answer. If anyone knows the answer, please let me know. Moving on to the next one. Okay, this again is a question which I'm not very sure, but this is a question which came yesterday for the INICET November 2022. The most common cause of moderate to severe blindness. I had mentioned an answer, like I had marked an answer, but I am not very sure about it. That's why I'm not discussing. The options there were cataract was there, glaucoma was there, refractive errors were there. I am not pretty much sure about it, so I'm not discussing. But I have attempted that question anyway. Moving on to the next one. Zellweger syndrome. Okay. 49th one. Zellweger syndrome is caused by defect in which organ? So the answer to this is peroxisomes. This was again a direct. And next question is tissues dependent on insulin. This is a multiple correct answer question, so we had to rule out the ones which were not there. Pancreas was an option, then placenta was an option, then muscle and adipose tissue. Those were the option. So the correct answer among them is muscle and adipose tissue. So this completes the first 50 set of questions. Now I'll be uploading majority all of the questions. I'll try. I have already made like around 120 questions I have with me, and I'll be uploading soon. So guys, stay tuned and we'll be continuing. Please subscribe my channel and please support me.